Hello, I'm Matthew Weinstock with Hospitals and Health Networks, and a look at our February issue. The cover story takes a detailed look at how hospitals and health systems are navigating the tricky migration to population health management. There are a host of initiatives underway that are prodding hospitals along that road. There's a lot of risk and a lot of reward. Here's Bill Santamore with a closer look.
Our cover story in February looks at the risks and rewards hospitals face as they move into population health management. That move is being driven by the transition from healthcare's so-called first curve, in which providers are paid on a volume basis, to the second curve with value-based reimbursement. Medicare and private insurers are gradually instituting payments that include rewards and penalties for system-wide performance on population-based metrics like readmission rates and preventive care for chronic conditions. Managing population health requires healthcare systems to reorganize horizontally, integrating inpatient, outpatient, rehab, nursing home, and preventive care to meet specific performance benchmarks. Our article by contributing writer Howard Larkin takes a look at a variety of hospitals and health systems, including Heartland Health in Missouri, Henry Ford Health System in Detroit, Lehigh Valley Health Network in Pennsylvania, and North Shore Long Island Jewish Health System in New York City. They're all studying their various options, their financial capacity for taking on risk, and possible partnerships that will lead to success in managing their particular population's health. Howard also makes use of new data that's coming out of the AHA Health Forum Healthcare Data Center survey on new models of both delivery systems and payment.
Thanks, Bill. Next up is staff writer Marty Stepniak, whose quarterly series on patient engagement kicks off this month. Getting patients more involved in their care is central to moving towards a value-based delivery system.
So patient engagement has long been a topic of conversation at the board table and in the C-suite, but it's been getting pushed to the forefront for hospital leaders in recent years as the healthcare system moves to a more value-driven approach focused on avoiding unneeded care and treating the health of populations. In this first installment of the four-part series, we give a broad overview of the topic. It includes interviews with leaders in the healthcare field on how hospitals are engaging patients across a continuum from the individual level to out in the community, hoping to get ahead of health issues before they show up in the emergency department. Patients are filling key roles at some health systems, serving as advisors, taking part in rounds, or even sitting in on interviews for executive hires. Further installments of the series will appear in our June, September, and December issues, and we're also going to have additional content on our website in the coming months.
The current issue also features Marty's interview with Kaiser Permanente CEO Bernard Tyson. Tyson discusses his desire to create a more affordable and accessible healthcare system. So here's back to Marty with more details.
Kaiser's new CEO tells us that keeping care affordable is one of the health system's top priorities as it works to attract new members through health insurance marketplaces. He points out that nationally, healthcare costs represent about 18% of the gross domestic product and are on a sort of unsustainable trajectory in the long run. Locally, Tyson says that there are millions of people who are willing to become members of Kaiser's health plans, but they just can't afford it. He believes that flies in the face of the organization's mission, and he's making it a priority to deliver an affordable health plan to potential customers that offers the full range of services that any Kaiser Permanente member might receive. Tyson also spent a few minutes discussing the importance of employing a diverse leadership team and how it can help hospitals to better grasp the needs of the communities they serve.
Also this month, we have an article about the fast-approaching shift to ICD-10. The compliance date for that new coding system is less than 8 months away. Writer John Morrissey examines where hospitals should be at this point of that transition and how they can play catch-up if necessary. For that story and more, be sure to check out the February issue of H&HN. I'm Matthew Weinstock. Thanks for tuning in.